Okay, what's up everybody? Dan here, and this is For Your Mental Health. So my last video was part 1 of what is depression. And if you watched it, thank you so much for watching. Hopefully it helps to inform you a little bit more about what depression is and how it has affected me. And so now we start on to part number 2 of what is depression. And in this video I hope to cover the causes, the treatment, and the types of depression that are out there in the world today. You know, hopefully we can once again answer more of this question of what is depression, get more information out there, and make you feel more well-informed and maybe better out about your own situation that you have currently with your own mental health. So let's get started. So as far as the causes of depression, well, it says here, once again, I'm quoting from a website, Very Well Mind, I believe it is. So I'll put that in the bottom. I'll list that below. You can check that out. Causes of depression. Depression is a complex condition, and its causes are not fully understood. However, various contributing factors can lead to depression. These can include biological factors, for example, genetics or experience of physical illness or injury, and psychological or social factors, such as experiences dating back to childhood, unemployment, bereavement, or life-changing events, such as pregnancy. Having a long-standing or life-threatening illness, such as heart disease, back pain, or cancer, has been associated with increased risk of depression. So we have some of the causes there. As far as what the treatment is for depression, well, depression is very treatable. But only about half of all Americans who are diagnosed with depression in any given year get treatment. So it's not a ton of folks, that actually are diagnosed with depression. Only about half. Those who do seek treatment wait months or years to get help. So that certainly can, be quite a limiting factor. If you don't get help right away, if you wait months and years, it just builds up the depression and certainly gets, compounded as time goes on. Many individuals with depression who seek treatment are undertreated. And studies consistently show a combination of talk therapy and medication can be most effective in treating depression. So those are the most effective ways in treating depression in the current day: talking therapies and medication. Here are the latest statistics on depression treatment. So only 1 in 5 people receive treatment consistent with current practice guidelines. So about 20%, 1 in 5. That is nothing. That is hardly anybody. So that needs to change. 6% of people with depression are treated with medication only. So that's a very small percentage. Only 6% medication only. So they would not receive talk therapy. They would just get medication and go from there. 37% of adults with depression receive no treatment at all. So that's definitely a number that has to go down. Like way down. That's close to almost half that receive no treatment at all for depression. People trying to tough it out, be the alpha male or the tough mom, that tries to do it for their kids. These are the things that we say to ourselves to keep us going, keep us going through it. But ultimately, treatment is going to be the way to give yourself a healthier road to healing, to being able to talk things out, possibly take medication to get you more regulated, your moods every day. Those are the things that you're going to need if your depression really is hindering you that much. And a lot of people want to put that burden on their backs. I can't show this to the world, but it's okay. Once again, it is okay not to be okay. And that 37% of adults who don't receive treatment at all, that's got to go down. That's got to be much lower. And if you're one of those people out there that doesn't receive treatment, and are feeling really depressive thoughts, please go and find help because that is what you're going to ultimately need to feel better about things. So, yeah. Let's go a little bit more into talking therapies. So, talking therapies involve speaking in confidence to a trained professional about problems or issues that may be causing concern. Types of talking therapies include cognitive behavioral therapy, or CBT, counseling, and psychotherapy. And your general practitioner can advise you about which approach you may find most helpful. So for me, I have been in therapy since January of 2018, I believe. So about a year and a half, a little over a year and a half now. And, I have really gotten a lot out of it. It's something that has been a real breath of fresh air for me, to have someone to go to talk to about my issues that I'm dealing with on a semi-weekly basis. Every other week we do it now, and it's just it's nice to have that helpful person to bounce things off of and to give you advice on how to handle things, and just kind of get a better insight of what's going on inside of you. It's not just all the inner dialogue, it's the inner dialogue kind of coming out of it, to someone else in the room. And with their, years of experience, my therapist, she's great. We've kind of grown together in this last year and a half. I've learned a lot from her. I'm sure she's probably learned some things from me, and it's been a great relationship for sure. And it makes me feel like I don't have to hold things in as much anymore. That there is an outlet for those negative feelings, negative thoughts, and it's good to have someone there, to talk to, even if you're not going to therapy, even if it's just a friend that you may have, that you talk to, all the time, just to just sort of be that, that lending ear, someone who will listen to what you got to say. That you don't feel so alone in the world. So, for me, it was important to get professional help and, to really get to the bottom of what was happening inside of me. So, talking therapy has been extremely helpful in my life, and hopefully it, can help you as well, if you're dealing with certain things that you need to talk about too. So I definitely encourage you to, go check those things out, find a therapist, if you really think you need it. Medication, I don't have a lot of experience with medication. Antidepressants, these are the things that are prescribed to certain people where, maybe talking therapy may not be enough, or in conjunction with talking therapies. If one medication does not work, you may be prescribed something else. It is important that you take the medicine for the length of time you're recommended by your general practitioner. Certainly true. I just watched a video from the overly attached girlfriend.
Wow.
I believe her YouTube name is Laina, something like that. And I just watched her goodbye video to YouTube. She's basically finishing up with YouTube, starting a whole new, part of her life. It was time for her to make a change. She'd been on YouTube for a long time as this, meme-worthy character. And watching her story of going through depression and, basically living with a lot of, dark representations of what was going on in her life, not having purpose, feeling the stress and pressure of being a YouTuber. I mean, those are certainly things I can relate to as well. So I really appreciated her sharing that. And, she even recorded little bits of video that she wasn't planning to share to anybody. With her just kind of talking to herself, talking to a camera, and, trying to let things out, have an outlet, to tell the camera how she really felt, and, have some way to sort of document that in case she ever wanted to share it. And she did in her last YouTube video, and it was really powerful. So I definitely recommend watching that. I'll probably link that below as well. But yeah, she took medicine. She was talking about her depression and how she had taken medicine to regulate her mood more, to make the days, more bearable. It's not a cure-all, as she was saying. She was saying that it just, made the bad days better. That they still come, but they would give her more of a buffer, I guess, between the very low moments that she would face normally. So the medicine really helped her get through the day, which is great. Yeah, your treatment approach will be informed by the severity of your depression. So those with mild to moderate depression may benefit from talking therapies like we've talked about, whilst people experiencing moderate to severe depression may find antidepressants or combination therapy to be more appropriate. There are other treatment options beyond medication and talking therapies. For instance, people with mild depression might find exercise, self-help, or mental health apps to be helpful. And that certainly has been the case with me as well. Exercise has been a big thing. I think I talked about that more in the first video. I try to work out 3 times a week, training for Warriors, TFW, what? Coach Josh and everybody there have been really supportive of me, and it's a really great environment to go and, let off some steam, work out and lift some weights, and get the heart rate up, work the core, all these different things. And every time I'm done, I feel so much better. I just feel like so much more focused. I've got a clear mind. It's all the things you really want, in a quality of life. And definitely working out, on that schedule has benefited me tremendously to work out there at TFW and have that schedule and just go and know I'm going to feel better afterwards. I mean, it's just it's a really beautiful set of things that I do there with the people that are really knowledgeable and very positive. So that has helped out tremendously for sure. See, self-help, I mean, that kind of goes along with checking out, well, I watch a lot of YouTube videos, so I try to get other people's perspective on things and, watch other people's stories, trying to gain knowledge from how other people have dealt with depression in their lives and try to apply it to mine. So yeah, that's definitely something that I try to do. And I mean, make these videos. I mean, this is the perfect example of self-help. You make, for your mental health videos. You put it out there. You share your story. You talk about these things. You open up, and you know that you're not alone in the universe, that there's other people that deal with the same thing you do, and you can, bounce things off of each other and see that other people have gotten through it. And it's an example that people can really hold on to and be like, well, this guy did it, maybe I can do it, and that's really powerful. And so, that helps not only, you guys out, but it helps me out too. So that's definitely a big one, is self-help. And the mental health apps, I really haven't used them, honestly. The only thing I've really used a lot, I don't know if a lot, the only thing I've really used much would probably be, once again, back to YouTube, where I've watched mindful meditation videos, where they just have a bunch of videos where they give you positive affirmations that you listen to with pleasant music. They kind of make you feel more calm, more collected. It just kind of resets things. You close your eyes and you listen to these sounds, and it's very calming, and you kind of find your zen place. And it's, maybe for 10-15 minutes, but for those 10 or 15 minutes, you're really resetting everything. And it's just kind of taking the edge off of the harshness of the everyday grind of life. And that's really, really quite effective when you're feeling really stressed or really anxious. Mindful meditation has been quite helpful, and I learned about that through talking therapy. So that's another reason to go. You find new techniques if you get into therapy. So definitely recommend it once again. So if you have depression, it's important to speak with your general practitioner or care provider for more detail and to discuss which treatment may be most appropriate for you. So that's certainly true. I would say, find a licensed professional, and they can give you some professional advice as to what you should probably go towards as far as the treatments of your depression. Absolutely. Finally, there are some types of depression I wanted to touch on before we close this out. Seasonal depression, which it's a depressive disorder with a seasonal pattern, formerly known as seasonal affective disorder, and it's a pattern of depressive episodes that occur in line with seasonal changes. Most commonly, it is diagnosed in winter in people who live in colder climates. I got a roommate that's kind of like that. Whenever it gets cold out, he's just kind of down in the dumps. He wants to go outside when it's warm out, have fun in the summertime, springtime, go to the park, go to concerts, have fun outside. So I've seen that firsthand for sure. And the second one is postpartum depression. So it's common for women to experience stress, sadness, loneliness, and exhaustion after giving birth. But some women experience postpartum depression that makes it difficult for them to care for themselves or their babies after giving birth. So about half of all women who are eventually diagnosed with postpartum depression begin experiencing symptoms during pregnancy. So there you go. So it actually starts before they have their children. So that's interesting to note as well. Yeah, those are the other three things I wanted to touch on in this part 2 video: the causes of depression, some of the treatment options, and some of the types. So there's probably more you can go into this as far as depression goes, and what it is and how it has affected me. We certainly could talk more about that, and we will probably in other videos that have to deal with similar subject matters. But I think for now that's a good place to wrap things up for what is depression part 2. If you have any other questions, you can put them down below in the comment section. Maybe we could talk more about this as a community of people who want to raise mental health awareness and, make sure that people are taken care of, and that that you're not alone in the world, that people deal with the same things you do, right? So this is what this is all about. But yeah, thank you so much for watching part 2 of this What is Depression video. More to come in the coming weeks, months, years, who knows? We'll see where this goes. But share this video with people that you care about, that think you think that they may gain something from this type of discussion, this knowledge, and let's keep spreading the word about mental health, and make sure that we keep doing our best to make Chester proud, as Mike would say. So thank you so much for watching this For Your Mental Health video, and as always, follow your instincts and peace out.